continent with discouraging narratives from lack of security to dilapidated infrastructure and to poor health services. So we thought as a group we could be part of the solution rather than being the problem. The problems are, in health sector are things around medical quackery or clinical errors, brain drain, poor patient to doctor ratio, poor health seeking behavior, stigmatization of certain individuals who don't want to be identified with certain diseases, affordability of tertiary health facilities. We therefore propose the solution that provides fast, discreet, direct access to trained medical professionals from the comforts of one's office or homes. The name of our solution is DocTap Remote Medical Diagnosis Telemedicine Application. The value propositions to serve as gatekeeping tool to screen diseases, obtain second opinion, and there are so many cases that call for action. Prominent among them is the death of Chief Ganifawa Emi, who died through misdiagnosis. And the cases, things that are the many problems of health system here, health system capacity, which is very poor, late reporting and presentation of cases and poor health seeking behaviors, the business cases, data for health policy and planning, adequate data for spot mapping, second opinion to prevent diagnostic errors by the physicians in this part of the world. And they have features on the demand side, the lounge, which provides opportunities for drug manufacturers and the government to sensitize the people, get care, emergency consultation, collaborative consultation by doctors, referral, communication is by threaded view. The notes of the doctors they have threaded view, confidential doctors note window and separate window for consultation conclusions, feedback by users to rate the doctors that they've consulted, and we're building an extensive network of doctors spanning 4 continents. The app screens, the secure login screen, the lounge where drug manufacturers and NGOs can advertise and sensitize people. These are still the part of the sample screens where users search for physicians to get care. The end-to-end process flow is such that a user downloads the application, registers, supplying data, and uses the password to sign in to look for a doctor based on whatever is happening, based on symptoms and classification of the symptoms. This is a cardiologist where users can actually look at the certification and look at feedback and ratings to be sure this is someone that they want to consult. And the chat screen continues to be available even while a call is going on, so that the doctors can be reached at the appropriate time. The proposed solution is built to provide access to physicians in the developed world who will be equipped to provide second opinion on treatments, evidence-based diagnosis, and real-time interaction with patients through the inbuilt video and audio callers on the application. The name of the application is DocTap. Tend to work first with the network of African doctors in the UK and the US. Through this, we can bring good health services to Africa. Thank you.